Evidence, evidence everywhere, nor any drop to drink. Evidence is what evidence does, and that's a philosophy that we share very much at the Bmj Evidence Center. For those of you who don't know the Bmj Evidence Center, you almost undoubtedly do know clinical evidence, which was our original contribution to the field of evidence-based medicine, conceived and created by Fiona Godley. The Evidence Center has subsequently moved on to support healthcare in several other ways. It helps to address the needs of policymakers through technology assessment. We ran a very successful work stream yesterday, which was extremely well supported by many of our colleagues from NICE and across the research community from the UK. Several of you will have attended that, and I know will be following through to other sessions of similar interest today. The Evidence Center also supports healthcare systems around the world, including Kaiser Permanente, and we've collaborated with them to share the resources required to develop high-quality clinical guidelines based on the theme of globalizing the evidence and localizing the decision. It makes very little sense for everybody to duplicate their time and resource researching very, very similar questions when in fact most of the customization occurs at the level of developing clinical recommendations. The Evidence Center is particularly interested in the needs and requirements of clinicians at the coalface, people who do the day-to-day work. Evidence is what evidence does. So with that in mind, let's have a think about today's agenda. One particular theme that I'd like to draw from the agenda is that of diagnostics. Diagnostic error is a major contributor to poor patient safety. I'd recommend, if you have the opportunity, to hear Kevin Jones talking about developing best bets for emergency medicine. Clearly in the emergency setting, as in primary care, determining what the appropriate diagnosis is critical. Also, there's the mysteriously titled The Dirty Side of Evidence-Based Dermatology. The mind boggles, but I suggest if you have the opportunity that you go to listen to Hugh Williams. Effective medical testing is also central to this. You'll have the opportunity to hear from Patrick Bussait, a gentleman whose work I'm familiar with because we relied on it quite heavily when we were putting several guidelines together for the National Institute for Clinical Excellence, and we actually went back to his paper in the BMJ from about 4 or 5 years ago to provide us with a framework in what is still now only a developing area. Implementation is another theme. We're very lucky to have with us today Steve Laettner, who is first and foremost a GP, but he's also the National Clinical Lead for Shared Decision Making for the Department of Health. Steve will be taking us over his work around pathways for effective healthcare. And you might wish to complement this by a visit to the Innovation Room, where you can see and learn about some practical tools that have been developed to monitor patients' progress through the healthcare system. Also, if you'd like a broader overview, then I'd suggest that you attend the session on using new technologies to improve healthcare by Lionel Tarasenko. Finally, Martin Marshall of the Health Foundation and previously Deputy Chief Medical Officer at the Department of Health will be running a session on how evidence can be used, has been used, and is used to improve healthcare. Now, I have to confess here, I have a lot of admiration for Martin Marshall and his work. I even have a folder at home on my computer with his name and all of his papers in it. So I know I will certainly be there. Finally, there are a plethora of sessions on the use of evidence for policymakers. We're very lucky to have Tammy Clifford from the Canadian Agency for Drugs and Technology in Healthcare. We have Mark Gibson from the Oregon Healthcare and Science University. We also have Stefan Lange from IQWiG, which is the German equivalent of NICE. And from NICE itself, we have Mike Kelly, who's a Director for Public Health Technology Assessment. So I'm sure you'll agree there's something there for everybody. And starting with the end in sight, we have a focus on clinical practice and also bearing in mind the current reality of the economic environment, we're aware of the resources, and there are many, many sessions that would help to put the use of those resources in its proper context.